We're back with new data from the CDC that shows rates of depression in the U.S. are increasing. The survey looked at people aged 12 and older. It found more than 1 in 8 reported being depressed in recent years. It's a number that has almost doubled in the last decade.
And that same survey shows it's twice as bad for tween and teen girls. More than 1 in 4 say they have been depressed.
Clinical psychologist Dr. Jennifer Hartstein joins us now with more on this. Doctor, good to have you with us. So do we know why we are seeing these higher depression rates, and just who is at the highest risk of being depressed right now?
Hey guys, thanks for having me. I think we are recognizing that there's a lot of factors that are involved in seeing more of this. Some of it is that we are talking about it more. So just in the conversation, we're decreasing the stigma, we're increasing conversation, we're increasing awareness. We know that some cultures are much more open to having these conversations, which is also really important. And listen, we're in a whiplash culture of stressor after stressor after stressor right now. So we are really frustrated and overwhelmed. And all of those challenges add to this sense of uncertainty, this sense of fear, and increases people's depression.
And the survey also revealing that women in general are more likely to have depression than men. Do we know at all why that is?
There's several reasons. One is generally women are more allowed, right? We were kind of able to be more expressive or be able to be more emotional. The good news is that's changing. So hopefully that will continue to change and men can be more expressive. I think also there's the cognitive load issue for women. We carry more. So in carrying more, those stressors impact us more. And therefore we tend to, be more depressed and be more impacted by all the things around us.
Let's look at this number. A big majority of adults and adolescents surveyed said that depression, it's making work, it's making social activities, home life challenging, but still less than half have actually received counseling or therapy. Why are we seeing this large gap here between people who are experiencing the symptoms versus the ones who are actually getting the treatment?
It's a scary discrepancy to look at, right? And that so many people are suffering and so few people are getting support. And I think there's a lot of reasons. And the biggest reason is access to care, right? We don't have enough therapists to provide the support that many people need. And in that, we don't necessarily have access to the means. We don't have insurance companies reimbursing or people having the ability to pay for care. So that discrepancy is impacted by that. And if we can't help them get that additional support, it's going to continue to happen. And there still is stigma around going to therapy, unfortunately, and people are afraid to walk in that office and really know what that means outside of the office.
The issue with therapists, the shortage of them, the lack of coverage from health insurance, from what you've seen, is that an issue that is getting better or worse in just the last few years?
Joe, it's a hard one to answer. I think there is this real motivation to make it better. And yet we still butt heads with insurance companies thinking that physical health and mental health are on equal playing fields, right? And in fact, you can't have one without the other. And although we're looking at who is impacted by this, all of us have mental health and all of us have struggle. So we could all benefit. And once we kind of make that a more even playing field, I think we'll have greater access.
All right. Dr. Jen Hartstein, as always, thanks for joining us.